I took a picture. Okay.
Hi, my name is Karen Warren, and I go to school at Bates Technical College for LPN. And now I am gonna be performing a wound dressing, removing and applying um, dry dressing with sterile gloving. So I'm gonna knock on a patient's room. Good morning. Hi, Mr. Jones. Now, I actually anticipated a medication, pain medication, 30 minutes ago for Mr. Jones because of what we are going to be performing, a procedure that we are performing just in case for his wound. And he's going to be in a little bit of pain. So, I have gathered all my necessary equipment that I'm going to use for the procedure. I have my protocol, and I already look at the patient's information. Right now, I'm gonna check out, verify his name, date of birth, and of some allergies that Mr. Jones has. So I am gonna ensure his safety also, and if he's comfortable of the procedure that we are gonna perform for him. And I have already put the height of the bed properly to where we need the procedure to be. So Mr. Jones is ready. So I'm gonna put a I'm gonna sanitize my hands for 20 seconds and wait for it to dry. So I have this table to do my sterile field, but for now we are gonna be using it for something else just in case. But the table is ready for the dressing field if we need to. But I have all my necessary equipment here. So I am gonna apply a privacy curtain. Lift the bed. Ask the patient, Jones, David, XXXXXX, allergy, iodine, sawfish, and latex. So I'm gonna um, get a sanitizer again because I touched the patient. I'm gonna put a gloves after 20 seconds. So now I'm gonna wear gloves. I'm only gonna open up to where the wound is, and I don't have to expose the privacy or other body parts of Mr. Jones that we don't need to do anything with. So now I'm gonna put a track underneath the wound just in case if there's some drainage. And I will make this hazardous bag for all the soiled dressings that we're gonna be getting rid of. So now I'm gonna apply a little bit of saline to loosen up. But if I don't need to, if it's loose enough, then I don't need to right now in the procedure. So now I'm gonna start taking off, removing the dirty dressing. Mr. Jones, are you ready? Sure. Okay. So I'm gonna remove it very slowly. Very slowly so that the hair wouldn't. Okay. So while I am taking the gloves and everything, I have documented that the noted also that there is no presence of bad odor. any drainage. The wound looks red and firm to touch. And I have got rid of the dirty dressing on the proper hazardous bag. So now I am gonna do a hand hygiene. So now I am gonna um, measure the wound, the length, the width, and check for tunneling. So I have here a measuring device for the length of Mr. David's wound is 10 inches. That was the width, I'm sorry. That was the width, 10 inches. And the length is 2 inches. And the deepness in the middle is 1 inch. So now I will get rid of the soiled equipment. Apply sanitation again for 20 seconds and let it dry. So I already been documented. Okay. And now I will wear another gloves. And prepare my sterile field. So I have already prepared the tapes, which is right here. I put my initial, the time and the date while we're doing the wound dressing for Mr. David Jones. So I have checked also that there was no tunneling in Mr. David Jones's wound. The wound looks clean. So now I will clean, sanitize the table, which I did. And now I will open the saline to use for the wound packing, to pack the wound. So I will use this one right here where the numbers are so that I will know where I open it, because inside of this one is sterile and we have to keep it sterile. So I will open it and I will lip it and I will remember where I lip the saline. So now I have my dressing change tray, and I have to remember that the inside of it is sterile. So be very careful. I will only hold it outside and remind myself not to put any part of my fingers in the dressing change tray. So I will open it butterfly method. So now I will open my pad to be ready. I will only pinch it 1 inch in the outside. Whatever I hold, that will be my bottom of my sterile field. Take it away fast. Only hold the edge. So now I will pick up the dressing tray and pour all the equipments that I need. And I cannot throw the tray because I will pour saline inside so that I can use the packing materials and put it there before we can put it in the wound of Mr. David Jones. So here's what I'm going to do. Be careful not to go in the sterile field. Maintain the sterility. And now I'm going to get rid of the saline cup. And the saline is already placed in the sterile tray. So now I'm going to go far and keep the field sterile. So I will take my gloves again, and I'm going to sterilize my hands again for 20 seconds. And now I'm going to have to pull any extra clothing. And now I'm going to perform the sterile gloving. So my hands are sanitized and clean. And I took all my jewelries and everything to so that I won't poke a hole in my sterile gloves. So here you go. I will open it, a butterfly, and I will drop it in the table. And I will get rid of the thing. And now I'm going to pick it up just in the edge and place it. Okay? Always make sure that I can only touch very little, the side, 1 inch of the paper. So always remind and put it in your mind that this is sterile. Keep it sterile. So here you go. I'm gonna use my glove, my left hand first, and I will only pick it up with the edge of the glove and put it in my left hand. And be careful not to touch anything. When I pick up the gloves, I have to take it away from the wrapper. And avoid flicking. And now, I'm going to pick it up from my right hand. Remember not to flick and hold your hands together. So now, I am ready to perform my sterile dressing. So I'm gonna pick up the sanitizer or the cleaner so that I can clean the wound. Start from the dirtiest to the cleanest. Do not fling I have some more bandage to use, but this one is already taken out, so I'm just gonna discard this one and not to use it. And I'm just gonna throw it in the garbage. So now I'm gonna open it up and start cleaning the wound. In the dirtiest part to the cleanest. So I am done with that, so I'm gonna throw this one in the garbage. And now I will pick up the forceps and um, and put put it into the
Okay, so there
saline.
is a mannequin available in the payment. Sorry.
Um, so I am gonna take it out, and I'm still my hands are still sterile. So I'm gonna pick up the um, packing material and put it in the saline and drop it there fast.
Okay. All right, fine.
So now I will pick up the forceps.
All right.
So now I am gonna apply the packing materials. I'm gonna pick it up with this one. And I have to remind myself that I will only use one hand so that I can use to pick up the other hand that are still sterile, because it's gonna be hard for the packing materials, so I have to make sure that it stays there. So here you go. So now, because I touched this one, I'm just gonna get rid of it. So now my left hand is dirty, but I still have my right hand that I can pick up the bandages and the rest of the dressing. So now my hands are okay. I am done with my sterile dressing. So now I can actually take it off and apply the tapes. And now I am gonna apply a sanitizer. I already have put my initial time and date. Gloves. I have to wear gloves. I have my gloves, thank you. I'm gonna cover the patient, Mr. Jones. And I will take away the hazardous soil dressings and garbages away from Mr. Jones. Be careful not to fling it. So I will close it and I will dispose of it into the proper hazardous garbage. So now I am going to ensure safety and comfort for the patient. I will put the bed into the lowest position. I will put back the 2 railings. I will not put 4 because it's a sign of I can't do that. So just for safety, I will give Mr. Jones his call light. Here you go, Mr. Jones. Do you need anything? Like water? Do you want the bed a little bit raised? Is that good enough? Yeah, sure. And Mr. Jones, do you have any questions of the procedure that we have done for you today? None? Okay, you just want to go back to sleep? Sure. So I'm gonna get rid of my gloves and I'm gonna apply a sanitizer. Okay, and I will document my findings from the wound dressing, and applying and removing. And when I check the wound, I have already documented the width and the length of Mr. Jones's wound, and if it was has odor, clean, has tunneling, and Mr. Jones's wound is has no tunneling, and it was red, pink red, clean. I did also ask the patient if he has some concerns and questions, and he said none. So I disinfected and washed my hands, and I ensured the safety of the patient and put the bed into the lowest position. And I'm gonna open the curtain now, and I will dispose of all of the things that I need and clean it. And that's the end of my wound care, removing, applying dry dressing, and sterile gloving. Thank you.